So, good evening, ma'am, sir. I will going to perform an assessing the abdomen part of the body. So, first, my name is Jen Orillaneda from BSN 11H from Double Doctors College. I am your nurse for tonight. So, first is, I will going to prefer my all equipment. So, I have here stethoscope, rubbing alcohol, and gloves. So, after that, I will going to perform hand hygiene and then gloves. So, I will not use my gloves and then I will going to perform hand hygiene to ensure safety of the patient. So, after that, review the medical record of the patient, doctor's order if needed. Why it necessary to needed the doctor's orders to review the medical records? It's because stick that in the doctor's order, the nurse must perform the assessment of the abdomen at a 6 p.m. The patient is sensitive to cold temperature. Okay, so after that is I going to call my patient. Okay. Good morning, sir. My name is Jen Orillaneda from BSN 11H. I am your nurse for today. So, what is your name?
Sander.
How old are you?
7.
Okay. So, may gusto itawag sa im?
Sander.
Okay. So, after that is I will going to explain the procedure to the client and how can she interact during the assessment. So, Sander, I will going to assess you or perform the abdomen part of the body. So, can you please be comfortable and interact? Don't be shy. So, can you please stand straight? And after that, can I see your wristband? Okay. So, after that is ensure that the client has empty her bladder. So, ensure that the room temperature is warm. And when the patient is arrived, okay, Sander, got to CR, CR ka mo, wiwi ikaw. Okay. So, after that, why it necessary to empty the bladder of the patient? It is because to faster the assessment and no interaction about our assessment. So, after that, the patient is here. So, next is okay, the patient has position client in the supine position, cover upper and lower of the body of the patient. So, Sander, higda dire. Higda. Dire, swag. Swag. Swag pa. Then, put the pillow in the back of the feet of the patient. So, I will going to put the hands in the chest to across. Then, put the pillow in the lower parts of the body for the private part. Then, observe the abdominal skin. Note for any vascularity. Note for any stretch and assess scars or lesions and rashes. Okay. When I inspect the patient, abdominal is also normal. No rashes, no lesions, and no scars. The color is normal. It's not discolorant. It's also normal. And after that, I will going to the next parts of the abdominal observations. Inspect abdomen for contour and symmetry. The normal finding of this is that is abdominal of the patient must be flat. Okay, flat the patient. And also or round them. So let's go into time on the sides. Okay, the sides of the patients. And inspect as you inspect. Okay, as you can see, um, there are no signs of burrowing or bulging of the patients and of the stomachs or bulging, the abdominal, the divisions, okay, and which is indicate that the inspect of the patient is also normal, okay. As you can see, the patient abdominal is also no lesions, and both sides, right and left, is also symmetrical, and the findings is also normal. Okay. So I will go into the next parts of the abdominal. Observe for the abdominal contour. We're standing at the sides of the patient, so we're going to stand at the side, and it must make sure that the abdominal of the patient must be symmetric. If not, that may be an indication, and that is not normal. So I will be inspect the side of the patients. Okay. And next is I'm going to inspect if as was expecting, is there are no signs any asymmetric, the symmetric in the abdominal of the patient, or asymmetry in the abdominal of the patient. Okay. So next is to ask the patient if they can deep breathe, or and to hold it one way of knowing that the patient is normal is that there no enlargements to observe deeply as he is going to do. So sir, ginhawa. Sige ra. Okay, the patient as the was holding his breath or taking a dip, there are no signs of any enlargement or of the liver, the stomachs. Is next is I will going to inspect abdominal movement when the client needs. Observe enlargement or palpation, and train that indicate the presence of the things of a normal. So I will go into the side of the foot of the patient to inspect. Okay. Okay. So after that is, and if there are any observation that may be an indication that the patient may be suffering from something, so there are presence of the movement of the stomach or the abdominal of the patient, so the client, and there are hereditary palpations or presence in stuck up domain as well as. So sir, ginhawara. Okay. Next is to assess the symmetric of the any concerns of the patients. Okay. Okay. So next is findings the abdominal that the patient. Next step could be observe the abdominal movements associated or the with pintinalis or unique positions normal there, and and signs of perithalis and the client's abdomen, which is normal, and if there are no movements in the abdominal of the patient, there is an indication that there is an abdominal presence with next we must inspect further vascular part pattern, and one thing of knowing that it is normal is that there are no signs of any muscular pattern. So cervix even answer the movement of the abdomen of the client is normal, and there are no vascular patterns visible. And I will going to inspect the abdomen. So ginhawa there. Okay, so after that, the movement of abdomen, the client is in the normal state. Now we are going to perform the rotations of the abdomen, and we are going to do is to just rotate the dummy from low sounds or vascular sounds where Tanya fractions rubs. And first we're going to do is to warm hands and the circumstance of the status code, that the reasons why are going to arms, hands, normal, stethoscope, so or the diaphragm of the stethoscope, it is to avoid the contractions of the individual vasculars of the patient's abdominal of the transmitted to use the stethoscope. So Sander, I will going to palpate your lower upper quadrant or right upper quadrant. So using the diaphragm. Good. There ta mag-una sa right upper quadrant. Inhale. Exhale. Next is the left upper quadrant. And next is right lower quadrant. So next is the left lower quadrant. Okay. That the patient's quadrant is also normal. The sounds is also normal. Not not also trouble to inhale, exhale, to holding her breath. Okay, the fiction rub is like two letters rubbing against each other. Implementation infection, abnormal growth in the abdomen. Now we must perform the prescriptions of the abdomen, and the things do first is the cause several areas in each of the four wards run to determinations of the abdomen. The abdomen is also if there are abnormal or normal sounds, it indicate of the client. So we are going to symmetrics. We'll start there going 1 2 3 4 1 2 3 4 5 6 7 8 9 10 11 12 13. Next is listen for the vowel sounds universe out of the care every 4 for 20 seconds, 5 to 20 seconds. That's what I'm hearing, or what who I have learned from the consultations that are muscular, if power, and the 4 quadrants of the client. As for the vascular sounds, we must the beach of the this telescopes over than the serves not arteries or iliac arteries and femoral arteries. So there, one to limbo. Okay, sa renal arteries, iliac arteries. Okay. Okay, is after that is drive if there is an rubric presence as and going to us of the dominants replying that in the can indication that is an abnormal of your aortic or aorta, renal arteries, iliac arteries, and what is keeping from the vascular sounds of the clients. Abdominal, there no presence of there as the liver spacing that the cystoscope over the aorta. Hawa. Okay, so after that is the sounds of the patient is of the vascular or the aorta is normal, and after that the presence of growth as I was facing that the aorta that is carries that the area arteries and it forwards the femoral arteries. Next is to going to ask the peritoneum fractions of the fractions rub is the two together the rubbering artery. So next is note the changes of the sounds from the tympani. You will notice, so we're going to start here. So there is changes some competitive dominance in because of their labor, and the labor sounds is up to the dollar. Next we must first is explained by starting at the left onwards, not change of loudness. Where clinic dullness. So start on the left knee tubular. So line. Eating herding, we must practice downwards as not to change from the analysis bleeding nobles. There are any changes of the songs from the pimping of the plain area, which is indicated that there are no mean in presence. There are findings of some of or, and also help the patient. So now we're going to perform the palpations. of the abdomen and the purse. We need to do this is to the client sit within her back to perform kidney to keep it the cause and critical interorbital ribs. We're going to place and left on the sides of where the kidneys and strikes. Others hand creating a first why we're going to this that in order for us to identify where any tenderness presents in kidneys, any pain felt and sakit there. The tenderness or pain, that's what I'm assessing that make it meet of the kidneys. So place the patient back in the positions. Balik the position. Balik na there. Tigda to kaina. Okay. So next is over the quadrants of the abdomen using the fingertips and the deprimations at 1 centimeter at gently move the finger in the wrist area. So we are going to page starting from the upon of the centimeter in or the direct if there are abnormalities of the tenderness or any several growth presents. In the clients on the dominant position and abdominal, okay, okay, and abnormal, how we must percuss the spleen of the spleen and the first things you ducks your stand of the right inside of the client and reach over the abdominal your left arms and place your head under the position lower ribs and fill up gently if there finger pointing in the head and we are going to ask the client to inhale and press inwards to inhales and press inward and upward as your provide support with the other hands. Ginawa. Relax na, relax na. Okay. Next part is the palpating the kidney sides of the fingertips. So press your fingertips to the bottom. Okay, inhale. So there is no lesions, no tenderness, no throughout. It's normal, no abnormalities. is, so next is the left. So next is inhale, exhale. Pressing down. So we're going to clean the side area of the abdomen. So, iputang sir sa gitna ninyo ng analina. Okay. So, after that is that the patient is supine position. So, we're going to the positive part of the one. Okay. So that the patient is normal. So, no, the sounds is also detections. Okay. Sakit. Right? Ano ba pungi? Ang sakit. If there is a appendicitis of the patient. So around there is no signs of any obstructor or any appendicitis presents all now that we done assessing obstructor signs, it must be now perform hypersensitive tests. After that, the patient is in a supine position or neutral position. Stroke the abdomen with sharp object or grabs the pole of the skin with your thumb and index and quickly let's go. So sir, if you can about my do the several times along that the dominar a note for compliance or pain exaggerated like it's I'm going to do first is to press the fingertips of the liver border at the right costal margin area and then ask the patient to inhale and exhale. Okay, inhale, exhale. Okay. After that, so there are anything the complete or compliant and from the dying for mass false note the which area from was felt and it's then are no pain, that was the indications that the client, there is normal. And next is to palpating the bladder, palpate the area above the pulse symphysis if the symmetry indicated to the out area of the body. So we are going to from the start. So these are the time or no signs of the indication lesions of the patient. So now I will going to inform the patient that the assessment is done, and for thing to the cooperations and interactions or confidentiality to attend our assessment. So sir, the assessment is also done. So thank you for your cooperations, and thank you for your interaction for our assessment or coming for my assessment. So for today the assessment is done. So after that is I will going to perform hand hygiene to ensure the safety of the assessing. So after that is I will going to determine or the documents is going the document or find the document the findings of abnormalities or normal of the patient, and going to the documents report. Then thanks the patient that